we speak about subjective visual vertical. All animals...
Dr. Toupé, a recognized expert in the field of neurotology, came from Paris to teach us how important otoliths and graviceptive inputs are and how we can test them. Subjective visual vertical test improves more rapidly if the peripheral lesion is on the non-dominant side of the vestibular cortex. SVV can be sensitive for central lesions as well.
So important to understand how the patient stands and how he is in this brain also, not only with some other part more archaic. Some patients have a very rare experience of out-of-body.
Out-of-body sensation.
Sensation, to be not here, but here. Two systems analyze our body scheme. Some egocentric, visual, and proprioceptive when we touch, and some are inner, egocentric. I am in, and my proprioception and my autolytic system tell me what I am. And sometimes there are a short discrepancy in these two models, two internal models of your body scale.
Dr. Blerdov from Berlin presented a very new diagnostic tool called VHIT. He presented his experience with patients suffering from vestibular neuritis, Meniere's disease, vestibular migraine, and acoustic schwannoma. VHIT shows good sensitivity for acute lesions, but it is less sensitive for chronic ones.
Many thanks for the invitation. It's a great honor to be in Belgrade and to speak in front of all these people from Serbia. So the benefit of our patients is the VHIT is a very easy test to perform. And if you have a patient with an acute vestibular syndrome, you can very easily perform this test, and you get very easily a result whether it's normal or abnormal, and you can decide whether the patient has to be referred to the ENT department or more or less to the neurology department. So, great test. Most convenient thing about the head and pulse test is that you can test all 6 canals, not only with calorics. You can only do it for the horizontal canal, but you have to.
So we get much more information.
We got a lot of information, much more information. So we can decide whether only the superior or the inferior branch of the vestibular nerve is affected.
Debbie Kane from Reading talked about VAMPs by emphasizing electrode placement as important for a good response. VAMPs are very sensitive in detecting superior canal dehiscence and other third window lesions. OVAMPs represent utricular function. Frequency shift can be used to diagnose patients with Meniere's disease.
I think it's a really useful adjunct to the normal tests that we have, the calorics and the VNG. You're testing a different part of the system. So if you've got a normal caloric and what sounds like a vestibular neuritis patient, by the C-VEMP you can test the inferior portion of the vestibular nerve. VEMPs are very useful for patients with superior semicircular canal dehiscence when you're suspected of that with threshold measurements.
That's the new diagnosis emerged recently.
So yeah, superior semicircular canal dehiscence, it's shown to be very sensitive for that. You get a lower VEMP threshold.
Please tell us these VEMPs, how much they help us diagnose patients with Meniere's disease?
So this is an up-and-coming area of research, and there's still stuff to be done. But in particular, we're looking at the shift of the tuning curve for VEMPs, recording from 500 and 1,000. In many patients with VEMPs, we see a shift of the tuning curve, and that might be a diagnostic factor in helping us diagnose Meniere's. But it's a bit of an up-and-coming area, so it's not lots of unanswered questions there. So the O-VEMP is thought to predominantly test the superior portion of the vestibular nerve and the utricle, and there's very few tests around that are testing the utricle. So again, it can be adjunctive to the test battery when we think there might be an otolith dysfunction. Also, we think that O-VEMPs might be more sensitive in patients with Meniere's and superior semicircular canal dehiscence.
New Diagnostics in Neurotology was the name of the second Belgrade Balance Forum, which gathered 120 doctors from the Balkan region. Doctors were thrilled to hear about new tests which had emerged in this developing field of medicine. 3 experts came to Belgrade to give a lecture and share their experience in utilizing new tests in clinical practice. After the lectures, they moderated workshops that allowed doctors to try these new devices and learn how to use them in everyday practice.
Ove prezentovane dijagnostičke metode nam pomažu da savladamo nove tehnike koje se koriste u ovoj dijagnostici. Kao i svaki put kad dr. Pavlović naš organizuje, bilo je fenomenalno. Imali smo goste iz svih zemalja u okruženju, iz Mađarske, iz Slovenije, iz Hrvatske, iz Srbije naravno, iz Makedonije i koliko sam ja uspeo da čujem od polaznika, svi su bili jako zadovoljni.
Kako ste se proveli danas na seminaru o novim dijagnostičkim metodama o vrtoglavici i neurotologiji?
Kurs je bio fantastičan. Srećna sam što smo u stvari imali priliku da kod nas sretnemo i čujemo predavanja od ovako velikih imena koje se bave neurotologijom. Ovo su sve nove stvari za nas. Mali broj u stvari kod nas audiologa ima ovu opremu o kojoj smo danas slušali, ali što kaže budućnost nosi nove lepe vesti. Mi smo već dobili cervikalni vemp, tako da će nam ovo svakako iskustvo koristiti da primenimo znanje.
I am interested in otoneurology and exactly in cervical and ocular vamp, and it was very great and it was very interesting, and I could try this video hit system. It was great, and the subjective vertical system. It's very interesting, very useful. Unfortunately, we haven't got this video hit, but we have got C-vamp and O-vamp in my office, and I am planning to use this video hit and this subjective vertical also. I hope so. I hope so.
Vidjeli smo nekakve konkretne stvari, naučili smo neke nove stvari, mada je ovo jedno područje u medicini koje je možda i najpropulzivnije, najviše novih stvari se tu događa. Tako da neke stvari odavno već znamo, neke stvari smo u posljednje vrijeme saznali i u terapiji i dijagnostici, a puno još stvari ima koje se moraju do kraja razjasniti, tako da ovo je jedan od načina da krenemo u bolju budućnost, svjetliju što se tiče otoneurologije.